Burn.
Thank you. Thank you very much for having me as a part of your session today, and good afternoon to everyone in attendance. And I want to welcome all of you to today's discussion on the Portion Balance Coalition's new report on the potential for portions to aid in the fight against obesity and its related illnesses. First, I want to thank Hank Cardello and the chair of the coalition for the introduction today and for inviting me to help you begin this important conversation. It is no secret that our nation is facing public health crises on multiple fronts, from diabetes to cancer to heart disease, just to name a few. We're seeing higher rates of these chronic illnesses than in past generations. We also know that for far too many Americans, these are often conditions that are comorbidities alongside complications with obesity. Many affected Americans are living in food deserts, are low income, and often come from historically disadvantaged communities. In many counties in my district, this issue has been compounded by structural issues, such as the lack of safe drinking water, an issue that I have dedicated a significant part of my 30 years in Congress to rectify. This is an issue that I'm also familiar with on a personal level. My late wife, Emily, fought a 30-year battle with diabetes, and her father was a double amputee when he passed away. And when I got elected to Congress back in 1992, I was faced with a dire statistic. South Carolina was leading the nation in amputations because of the late detection of diabetes. And of course, having a personal relationship with my father-in-law, that was a statistic that hit home to me. And so I worked very closely with the then Senator Fritz Hollins, and we decided to find a creative way to tackle that problem. And we did so through the defense budget. And I'm proud to report that we were able to convince the Department of Defense to fund mobile units to go throughout rural South Carolina to give the tests that were necessary. We were able to get off of that list as being number one, and I'm very proud of the results of that work. This information from the coalition's report can empower everyday people with the tools to address obesity head on. The second part of the solution is structural. House Democrats and I have consistently fought against deep cuts to programs like SNAP or food stamps and WIC, Women, Infant, and Children, which provide the economic assets to nutritious foods that these households need. We fended off cuts to these programs in this year's government funding bills and will continue to defend these essential programs. We've also seen access to life-saving treatments expand under the Biden-Harris administration through key provisions of the Inflation Reduction Act. Medicare has been authorized to negotiate lower drug prices and cap out-of-pocket drug costs at $2,000 per year starting January 2025. This change alone will benefit 1.1 million Medicare beneficiaries in South Carolina and will prove to be a powerful tool in our efforts to fight against obesity and its comorbidities. Additionally, the Inflation Reduction Act capped insulin at $35 per month for Medicare beneficiaries, prompting the three largest insulin producers to lower their prices to $35 a month for all privately insured patients. And I will continue to fight to expand these benefits to all. No child born with diabetes is able to select what economic conditions it will be born into. And therefore, a child with juvenile diabetes in a low-income family, in the wrong zip code, ought not be held hostage to these conditions. So we need to cap the cost for everybody. The research you are doing is a key part of your multi-pronged approach to address this critical issue. I look forward to learning more about the findings in this report and its impact on the health outcomes of American households. Thank you so much for allowing me to be a part of this discussion, and I look forward to getting your report.